yet. You haven't logged in yet. Casey, that's how we do it. Okay. That's how we do it. That was a new one.
I just didn't see the
Huh?
I just didn't see the water.
Oh. I was surprised she didn't come over here either. There was a guy next to you. Come on. All right, we're on. Yeah. Hey, ladies. So just as an FYI, they are gonna do a video, so I guess we're just gonna shoot the screen and hope on audio. You didn't know. You just found out. Yeah, so. Lack of planning, thanks. Appreciate that. How long do you think?
2 minutes. Just got a power cycle ahead. And they're getting ready to have a briefing in here, so my time is impeccable. So give it a check. Oh,
Yeah.
yeah, it's moving. Yeah. Yeah, no, that's all good. Okay, thanks. I'm gonna head over to state. Stand here.
Oh, thank you.
You're welcome. 1098-765-4321, House Radio TV 12.
Well, now I have to cut this, put it on the lens. Just like cut up like a really small piece.
Guys, tell me if you hear that center camera when he hits play, if you will. Hang on a second. No buzz. Go ahead. Nope. Can you turn it up on your computer? All the way? Go ahead.
One of the gentleman's arguments was that China.
Hang on a second. Let me set this one back down to 30. All right, ladies, ready? All right, go ahead, Kelly.
One of the gentleman's arguments was that China.
We're gonna try it one more time. You ready? I just don't wanna blast us up here. That's all.
Gentleman's arguments was that China hid the true risk of the.
Okay, we're good.
But Professor Reich, it's very good to see you again. And the HEROES Act was a bold, comprehensive bill that would have helped contain the virus, boosted our economy, and provided much relief to our states and local governments. The fact that the Senate didn't even debate the HEROES Act was legislative malpractice. And I want to focus on one provision that is often overlooked, and that is funding the Postal Service. And I just want to ask you, what would happen if we didn't pass the $25 billion in emergency funding that the Postal Service says that they need in order to continue working during this pandemic?
They're runner up. Heads up.
Good morning, everyone. Millions of lives and livelihoods have been impacted because of the coronavirus. In my own district, we are experiencing a recent surge in cases. These are our families, our neighbors, and our friends that have been hurt because of this problem. When I think of their pain, I think of the damage China is responsible for inflicting on countries around this world, and right here at home. China's deception has directly led to Americans' deaths. China covered the truth about the virus. China hoarded personal protective equipment and tried to extort other countries for political leverage. Now China is trying to hack our vaccines, which will harm our ability to serve the world and solve this problem. China is no friend to the United States. And that fact is clear to everyone except the Democrats. China tries to undermine the United States with every chance they get. Let's just look at the recent headlines. The Chinese consulate in San Francisco is harboring a Chinese military researcher, wanted by the FBI, who is accused of visa fraud and who lied about her connection to the Chinese military. We recently discovered the photos of her in the Chinese People's Liberation Army. We also found out that they have been spying and committing espionage from within our own borders in a consulate in Houston. They have now set fire to documents and would not even let the Houston Fire Department in. Makes you wonder what they are hiding or even what they are burning. A few months ago, U.S. authorities arrested a Chinese researcher in Boston and charged him with trying to smuggle 21 vials of stolen biological research back to China. Just last month, they caught another individual at LAX trying to fly back. And then we just found, as of January this year, top professor at Harvard being paid by China. Think of that. The very country that created this problem is now trying to sabotage our effort to save the lives. That is why I introduced legislation earlier this week to hold these criminals accountable. My question to my Democrat colleagues is simple. Are you willing to step up to stop these escalating threats from China, or will you continue to defend the actions of the Chinese Communist Party? Their actions and words continue to show Democrats have a China problem. Why did Democrats back out of a bipartisan task force after working for almost a year to get one stood up? Why did Democrats vote against a common sense piece of legislation to punish those who are trying to hack our vaccine research on the very day that we arrested 2 Chinese for doing it? Or let's watch this, the chairman of the Armed Services, Adam Smith.
One of the gentleman's arguments was that China hid the true risk of the virus from the American people. And yes, that is terrible that China did that. It's not actually their job to warn the American people. It's the president's job to warn the American people.
Why does the Democratic chairman of the Armed Services Committee, Adam Smith, say that it's not actually China's job to warn the American people or the world? They lied to us. They lied about the virus, and thousands of people have died. And now the Democrats do not believe it's the Chinese fault. Why does the speaker promote their propaganda by trying to blame the President of the United States for the Chinese Communist Party lies, even calling the virus in the name of our president? Why did Joe Biden just yesterday say it's wrong to hold China accountable? When I look around the world, from Italy to the UK to Australia, no one else is saying that. They have felt the pain of the lost lives. They've seen the heartache of the economic damage that has been done. And they understand the lie that China has given. If we want our children and grandchildren to live in the same country we are blessed to live in, it is time Democratic leaders in this country wake up and stop cowering to the Chinese Communist Party. The stakes are too high for an apology tour and leadership by appeasement. My final question would be, what does the Chinese Communist Party have on the Democrats? Why can't they hold them accountable? On a day that they were arrested for hacking in to the companies to steal a vaccine to save millions of lives, not just for America but around the world, the voice of the Democrats, where it's not the Chinese fault, and let's not hold them accountable, and they vote against an ability to sanction those who are hacking in, slowing the pursuit of a vaccine. That's unacceptable. And most of all, it's un-American. Open it up for questions. Yes, Julie.
Today, President Trump was going after your colleague Liz Cheney and retweeted Rand Paul and Matt Gaetz calling for her to step down or be removed from leadership. And I was wondering what your response is to that. And if you had
Look,
any
I know
thoughts.
people, in our party, we're allowed to have differences of opinion, especially when it comes to foreign policy. I think Liz Cheney and the president agree 98% of the time. And there's nothing wrong with having a discussion about different ways of going forward. But I think the best part is that we're united and we don't air these in public. Yes, ma'am.
Mr. Leader, Alexandria Ocasio-Cortez went down to the floor this morning and said that Congressman Yoho's apology was not enough, and that having a wife, having a daughter doesn't make a decent man. And she said his comments were indicative of his disrespect for her and for women more generally. Do you agree with her on that? And do you think Congressman Yoho's apology went far enough?
I watched that Congressman Yoho went to the floor, apologized not once but twice to the Congresswoman from New York. I watched the majority.
He said, "I refuse to apologize for my passion."
I watched the majority leader of the House accept his apology. In America, I know people make mistakes. We're a forgiving nation. I also think when someone apologizes, they should be forgiven. I don't understand that we're going to take another hour on a floor to debate whether the apology was good enough or not. He said I was sorry. He said, I'm sorry to the Congresswoman from New York. But the Democrats won't take an hour to debate the accountability of China. They refute it. They don't even give us a moment of time. But that's what we're spending an hour on, while I know in my own home community that we're getting a surge. I think that's a wrong opportunity. Yes, he made a mistake, and yes, he apologized for it, and yes, the majority leader accepted it. And yes, we have big work to do on this floor. And people should not be called names. People should be treated with respect, regardless of philosophical differences. And I stand by that. And I think it's appropriate that he apologized. I just think in a new world, in a new age, we now determine whether we accept when someone says, I'm sorry, if it's a good enough apology for them.
So Leader, how do you classify where Republicans are now in terms of stimulus package? And on the Senate side, we've heard some disagreement about spending numbers. We've seen $1 trillion floated, but there are some senators on the Republican side that even think that the $1 trillion is far too much. Where do you stand on that?
Well, there's a real concern, the amount of debt we have. I watched that the Democrats wanted to spend $3 trillion and talk more about cannabis than they did for research. I want to make sure the money that we spend is money that's needed. We have a large debt, and we want to make sure we're able to take care of it. We're going through something that we have not seen before because of the lies of China. People need help because people are uninsured. We need liability protection so small businesses can open back up. There is money that has been appropriated already but not have spent. There's more than $1 trillion sitting out there that is in the same position. We could actually utilize money that we've already appropriated to get the job done here as well. I hope that we take an approach that we find common ground to help the individuals who need it, to make sure the schools and the others are safe when they go to open again for the children and the teachers, to make sure from a small business and economic that we have pro-growth agenda in there, that we make sure that we bring back the supply chain from China into America. And I think we can do all of that, and we still have money inside that has been appropriated but not spent that could be better used for this, where we are today in this battle.
Do you know how long, is there a timeline on when we might see something on paper?
You know what? These are important bills. There's new data coming in every day, and there's nothing wrong with spending a few more moments to make sure you get it right. So I wouldn't give you a deadline. I'd rather have a bill done correctly than sit by a certain date. Yes?
There were a number of senators who've been concerned about the deficit at this point and how a large coronavirus response bill is just going to add to that. Have you heard concern from your members, and are you personally concerned, or would you rather see a higher number and taking care of?
I have been very concerned. It doesn't take a senator to tell me this. That's something I've been concerned with quite some time. That's why when we made a budget agreement, the Democrats didn't even hold to it. In 1 year, they went and spent $250 billion more. I watched senators on the other side actually blow through that budget agreement too, thinking they'd get Democrats to move with their appropriations, but they did not. If there's an individual that wants to hold very firm and make sure our grandchildren are not held with this big debt that's sitting before, but if you watch history and you study history, every great society has collapsed when they've overextended themselves. We are at that tipping point. We're going through a crisis, so yes, government has to be there to help. But we should not put us in a place that we cannot come back from. Yes. Oh, you have no.
Can I ask you a follow-up to
Sure.
this earlier question?
Yeah.
So President Trump is tweeting about Congresswoman Cheney, who's in your leadership. Do you think that she should stay in leadership? Do you support her as a leader?
Yes.
And then
No question.
are you concerned that this might be indicative, though, of a fracture in the GOP heading into the 2020 election?
No. Look, what's different between the Democratic Party and the Republican Party, we could have differences of opinion. Everybody's welcome in the Republican Party. We're proud of the fact of how we were created. You know, the first Republican president ever was Abraham Lincoln. You know who was in his cabinet? Those who didn't even agree with him. Because he believed in people having difference of opinion and be able to debate. The greatest challenge ever to our Constitution was the Civil War. But he was able to mend the country together. one of the biggest, I think, losses we've had in this nation is the assassination of President Abraham Lincoln. If you thought for one moment some of the crises that we're going through in this nation today probably would have never taken place. If Abraham Lincoln was not assassinated, it's easy to think about what America would have looked like. Malice towards none. The first 23 black Republicans elected to Congress. But unfortunately, a Democrat-controlled South decided that was wrong. So Jim Crow laws came about. They may have never come about had Abraham Lincoln not had to be assassinated. When those Jim Crow laws came about, trying to stop people from being able to register to vote, perpetuated a challenge that we have in this nation that Abraham Lincoln wrote about, that believes in this country that was conceived in liberty and dedicated to the proposition that we're all equal. So we all strive for a more perfect union. We lost a dear friend, but an individual that changed this nation in John Lewis. I spoke about him on the floor today. But yeah, he made this nation better. There's a lot of reasons why he could be upset with America, but he never believed being upset. He believed in working on America, making it more perfect, where we all should work towards. He didn't believe in violence that we see on the streets today. I think there's a lot of lessons that can be learned from both men. And I'm proud of the fact that I grew up in a family that we're not Republicans, but I chose to be in this party. Why? Because I see the difference. I see what one stands for and what another one stands for.
Can I follow up on that?
Yeah, please.
She asked about Liz Cheney as a woman. You concluded they were talking about two men. Between Liz Cheney and AOC, don't you guys have a woman problem?
No. So you just took the question, and let me paraphrase what you just said. In no phrase did she say Liz Cheney is a woman. She said Liz Cheney is a member of my conference. She's not defined by being in my conference because she's a woman. She's defined by being in my conference because she got elected, because she's the best person for the job. Yes. So if you think we have a woman problem.
The polls show that you have an incredible problem with suburban women, that if President Trump loses the election, that's why.
Okay, well, let's weight it in the areas you want. The question that she had was in regards to two people. Never did she relate that one person was a man or one person is a woman. She related to two people based upon the positions that they had. You took the question to relate it to a woman. So let me take the question back if that's the question. There are more women running in the Republican Party for Congress than at any time in the history of this party. The record was 143. We're well over 220. So if you want to measure it based upon that, I think we're improving. Do we have rooms for improvement? 100% yes. Do we have places to grow in the suburban area? 100% yes. Our newest members that elected to this Congress, Mike Garcia, he's not a woman, but he's a first-generation American. He understood why his father left the country to come to America, because he believed in a life better for his own children. He graduated from high school, got to the Naval Academy, and lo and behold, he gets to Congress. So do we have areas to improve? Yes, but are there improvements out there? I see it each and every day. And why? It goes back to the core of the answer that I gave her. The way the party was designed, the way the party was created, and our very first president. Her question related to two people disagreeing. So I related back to a man that happened to be Abraham Lincoln. I related to Abraham Lincoln based upon the cabinet in which he picked. There are books written about it that are bestsellers, that he did not pick his best friends. He picked people that actually ran against him. He picked people that were in his party that disagreed with him because he thought that was the best way to govern. So I took her question not based upon the gender of the people she was talking about. I took her question to be based upon the idea of the discussion.
So setting that aside, is it helpful for the president to attack the highest-ranking Republican woman in Washington?
I think they have a difference of opinion when it comes to national defense. I think it's better when people talk one-on-one. But I don't think in a party that our party disallows thought and disagreement. I think we actually welcome it. I think in this country you have a First Amendment right. In today's society, it's really interesting to me that if you wear a T-shirt and go fishing with your children, that you could lose $1 million in your contract because someone disagrees with the news station that your T-shirt says about. That's wrong. So I don't have a problem with people having difference of opinion. I think that's okay. But thank you. I appreciate it. Yes?
On the next stimulus bill, how much of a priority is it in your caucus to include the president's tax cut, payroll tax cut?
That is one of the elements we would request. There's also a number of pro-growth elements that we think to help bring the supply chain back from China when it comes to expensing and others. We also think there's a real challenge out there for individuals that they should be able to use their tax savings, maybe it be within private school. We think businesses should have an ability, if they're going to have challenges of have to pay for more PPE and making sure they have a secure and safe environment, maybe that should be able to be written off as well. There's a number of ways that we can help this economy grow, keep it safe, and make sure we combat and defeat this virus. Thank you all very much. Appreciate it.
Thanks for following that. I appreciate it.
You'll get in 5-10.
Yeah, okay.
I thought you.
is just making sure already deployed over 1,000 medical personnel to assist not only our hospitals, but also our COVID-only long-term care facilities. So we've been honoring requests, and we continue to stand by to help more. It's very, very important. One of the things I think that we've done and are continuing to build momentum on is support for residents in long-term care facilities. We now have what we noticed early on. Obviously, we limited visitation, required PPE. We sent huge amounts of PPE to the long-term care facility for the staff to do. We tested members of the staff and the residents in April, May, early June, which, we have over 4,000 facilities here in the state of Florida, so it's a big undertaking. But what we noticed was, okay, we weren't going to let a hospital discharge a COVID positive patient back to a nursing facility, but we also would have situations where someone may test positive at a nursing home, and that nursing home may not have the ability to appropriately isolate them. So we saw a need to develop these COVID-only nursing facilities, and so we now have 21 operating throughout the state that are COVID exclusive. We have 4 more pending, will likely be online by the end of the month, and that'll be a total of 1,700 beds. And so if you do identify a positive case in a nursing home, but that patient doesn't require hospitalization, you have a safe place where they can be isolated. If they're in the hospital but they're stable, this is a safe place for them to be discharged to without running the risk of expanding the spread to the most vulnerable in our society. And so that's been an important focus. I really appreciated the White House and the President announcing that they're going to be involved heavily in fortifying testing. What we're doing right now is, and we've already gone through one iteration of this, but we're testing every staff member who works at a long-term care facility on a biweekly basis. So that's over 200,000 people that are being tested every 2 weeks. Fortunately, the positivity rate has been about 3%, which is lower than it is in the community. At the same time, 3% of 200,000, that's about 6,000 staff members that have tested positive. And so, but we believe that periodic testing like that, routine testing, we could identify if a staff member has it, and that may be enough to be able to prevent it from spreading to the residents. So we're going to continue to do that. We're also dispatching incident management teams to all 4,000 plus long-term care facilities in the state to monitor infection control practices, screening of staff, sanitation, making sure they're wearing PPE. I mean, we've sent over 10 million masks, and we've sent massive amounts of face shields and gloves and gowns, and that's important, but obviously it needs to be employed properly. We did this at the beginning of the pandemic. We were able to help rectify some poor practices, and we're going to do it again just to make sure that we're doing the best we can. Most of these facilities have done a really good job of really sticking with this, and I think that's a testament to the fact that, while we have had outbreaks in these facilities, we've had fewer as a percentage than many other states, and I think that this is a big reason why. It's really important that we do that. Now, the federal government, they're going to be doing point-of-care testing. We're not exactly sure how that is going to shake out. We stand by to see that. But obviously, if you had a point-of-care test, when we're testing the staff, it's a swab, send to a lab, and the turnaround is good, about 36 hours, but that's much different, obviously, than point-of-care testing. And so if point-of-care testing is something that works and that is widely available, I think that would be good just generally, but I also think it would help in terms of allowing visitation into some of these facilities, which we've not done since the middle of March, and that's exerted a tremendous toll emotionally on a lot of people. It's been really, really difficult. So we're sensitive to that, and we would love to be able to get visitors back in these facilities, but just with the prevalence in the community now, even as we've seen the testing numbers stabilize, our percent positive is a little bit lower than it was two weeks ago. We were 15, 17%. Now we've been 11 to 13, and I think it is trending down, particularly in places like Central Florida, but where we are concerned about potential introduction of COVID-19 into some of these areas, and so we're looking at that every day. But I really appreciate what the folks in our healthcare system have been doing for many, many months. We've got a lot of people who've been working incredibly hard. It's not easy dealing with any pandemic, I'm sure. Heck, it's not easy dealing with some of the things they deal with on a routine basis apart from this. But I think just how intensive it is when you're dealing with a disease this infectious, for all the procedures you have to follow, everything you have to do, this has really, really been a lot of hard work, and a lot of people have done a heck of a job. So I commend people up and down the state for the work that they've done. I do think that we are going to head in a better direction here shortly. But in the meantime, just keep it up, because a lot of people are very proud of what you're doing. So it's an honor to be here. I want to bring up CEO Brett S. Rock, Health First Home Regional Medical Center.
Good afternoon, everybody, and Governor DeSantis, thank you for being with us today. It's an honor to be able to host you here at Holmes Regional, part of Health First. Health First providers and associates have made it their mission to care for our community. These are our friends, our families, and our neighbors, and we take great pride and care in providing them wellness and health care they need, no matter what. Within our integrated delivery network, we have more than 9,000 associates. For our associates, healthcare isn't just a job. It's a sacred and honorable calling to serve others, and many times in the most vulnerable times in their lives. These associates, especially those on the front lines, have been tirelessly dedicated to caring for those stricken with COVID-19, and of course, as the governor said, many other illnesses that they come in with on a daily basis. Despite the stress of long hours, a virus that clearly we're all still learning so much about, and the strain that can surround a constantly changing and unsettling public health crisis, the character and dedication of our healthcare workers has proven the community should rest assured that they're receiving the best care possible. Everybody's in good hands here. Health First associates are a magnificent model of calm and compassion. It's something that many of us need right now as we're going through this pandemic. Many have shown flexibility and openness to additional training in a time that they can assure they're ready to go wherever they're needed across Health First. Just as we plan how we can expand availability of our beds, our capacity for breathing devices, we also plan for how we can support our associates and to meet the needs of our patients. These providers and associates have shown incredible courage and continue to do so each and every day. Their humble healthcare providers continue to throw themselves into their work every day, helping to protect everybody they can in our community and nurse those who are sick back to health. We're incredibly grateful for all their contributions to our community, to our society, and with their knowledge and skills and compassion, they're a shining light for all of us. Thank you for all that you've done for our community. Jeff?
Thank you, Brett. And I'd like to echo the same to my fellow physicians, nurses, techs, case managers, food service folks, our facilities folks, and I'm sure there are even more. We know you're tired, but you still do it every day. Thank you. I'd also like to thank those in our community that have chosen to wear masks and follow other guidelines that help to keep us safe. But maybe I'd like to talk a little bit about what we've done here at Health First to both prepare and provide services during this pandemic. We've consistently prepared for scenarios to ensure that we have the expertise, staffing, and facilities for those that come through our doors. We've been diligent in our planning. Health First is prepared and will continue to make any adjustments necessary to have the capacity, staffing, and tools that are needed. Our hospital occupancy rates vary throughout the day, and we have various contingencies to open additional units if we approach capacity. While occupancy rates are higher now than at the start of the pandemic, we have surge planning in place to expand our ability to provide care, and we shift patients as needed to assure that they're receiving the level of care they require. As we often say, we're one hospital with 4 locations. We can quickly construct more spaces to treat patients with respiratory illnesses, and we can transfer patients as needed. We have increased our specialized respiratory capability to 208 negative pressure beds. Some people have also expressed concern here in Florida and nationally about the availability of ICU beds. And it is important to understand that an ICU bed is not needed for every patient with COVID, but just those that are most severely ill. For us, that's about 23%. But a typical COVID patient can receive exceptional care in one of our respiratory units. We've dramatically expanded our supply of breathing devices since the pandemic began. We now have 1,915 devices that can be used to help patients breathe, and that's literally twice as many as we have beds. So we continue to maintain precautions at all our facilities to protect our associates, patients, visitors, include social distancing, plastic partitions and check-in areas, hand sanitizing stations throughout our facilities, universal masking, and strict disinfection and sanitation procedures. We also reinstated a strict no visitation policy at our hospitals when the uptick occurred, obviously with limited exceptions. And per CDC guidelines, we recently mandated that protective eyewear be worn in our clinical facilities as well. We will continue to have the capacity to treat COVID-19 and non-COVID patients. We're ready for this and we're safe. So please do not delay emergent or urgent treatment. We're prepared to care for you no matter what. Brevard County has depended on Health First for over 80 years and will continue the legacy of caring for decades to come. Thank you.
Well, thanks a lot. Would you say that the people that have delayed care, when now you're seeing them now, that their conditions are worse than had they come in originally? Are you finding that?
Particularly early in the pandemic in March and April, yes, we had people delaying care, and for a period of time, we also held on electives as we had enough PPE. We have that now, and we continue now to do electives. So we're beginning to see folks come back, but yes, we did see delays in care.
Yeah, so I just, it's great to see, these folks in action, but also just making sure that people understand that the message of, the COVID is one aspect, but I mean, you go throughout Florida, most of the patients are not in for COVID. They're in for other things, and those ailments aren't going away. And if you do have symptoms, if you have heart problems, if you have stroke symptoms, they're here to help you. And if you go in and get that care early, you're going to be better off than waiting. And I think that when the country saw, and this was pretty much everywhere, a big drop in visits to the ED for particularly things like heart in March and April, and I don't think it's fully recovered yet. I think you guys are doing better than you were, but that's going to have some long-term health implications. And so they're open for business and they want to be able to serve folks. Also, just a couple things that I know people have been asking about. There was reports about Floridians signing up to take a COVID test, maybe deciding not to go or waiting in line and then just having to do something else. So they never actually got tested and then notified that they tested positive. We've looked at our state sites and we have not found examples of that, but I know most of the other folks who've talked about it, I think those were more private sites that they were talking about. But bottom line is it's something that we want to get to the bottom of. So if people have information, if someone sent you a letter or a text message or an email saying that you've tested positive when you actually haven't taken a test at all, that's something that we definitely want to look at. We've not been able to identify that just in the sites that the state is running with the National Guard, but it's something that I think is really important to get to the bottom of. And then the other thing, just yesterday we made a statement about education and how important that is. Our kids are ones who, they're the least at risk for this by far. They're the least important in terms of transmitting the virus, and yet they've really suffered a lot under the control measures that have been put in place since mid-March. And so that is a real problem, and I believe we need to give parents the options to get their kids back into face-to-face. If a parent doesn't want to do that, then they should absolutely have the right to do distance learning. But the problems that will mount by keeping kids out of school indefinitely, I think will be really, really significant. And so as we deal with the coronavirus, we got to understand that there's still all these other issues in society haven't gone away, and we need to continue to keep our eye on the ball. So I think the approach of choice, parent choose, you should have a right to have face-to-face, but if you don't want to do it and you're not comfortable, then by all means, choose distance learning. And the same thing with the teachers. If I know a lot of teachers really want to get back in, if others are, have health problems or just they don't feel comfortable, let's just make do with what we have. I mean, I think you'll see a lot want to go, some won't want to go with the parents, and I think it can work out. But to deny people the ability to get in-person instruction, I think that will be very problematic, and I think that'll create a lot of problems that we'll regret in the months ahead. And with that, happy to take some questions.
Governor, Shannon Butler from Channel 9. Can you address, we had 139 deaths in the state overnight. We talked in Tallahassee a few days ago.
Well, let me just correct you. So when the state reports that, that's not saying that those deaths occurred last night. They will report them if you look by the date of death. So sometimes those can go back months. Now, I think they've gotten better, but those have been, you look by the dates, those have probably been over a several-week period.
It's still a scary number. We talked in Tallahassee a few days ago, the Advent Health Doctor, to do about how he thinks Central Florida is lacking. When you look at those numbers, do you still believe that Central Florida is seeing a problem?
So I think when you look at this, well, one, I mean, obviously, we would love to have zero deaths. I mean, if we could do that, we would want them as few as we can. That's one of the reasons why we do so much in the long-term care facilities, because we know that if there's an outbreak there, mortality and morbidity is incredibly high. So it's a really, really important issue. And I think here in Central Florida, the case fatality rate is way below the national average, right? I mean, what did you calculate it at?
Yeah, so here in Florida, now the case fatality rate is lower, and then also the infected mortality rate is actually about half of what it is in the rest of Florida.
Yeah, so they've done a good job in Central Florida of having a very low both case and infection fatality rate, which is just, I think it's a testament to some of the treatment that we've seen. I think it's also just the fact that if you look at some of the infections in Central Florida, the cases have skewed younger than maybe some other parts of the state. And obviously, as we know, the fatalities are heavily concentrated in those who are in their 70s, 80s, and 90s. So you have that. But I would also say this. When you're looking at trends, when people are not coming to the ED in as big in numbers as they were 2 weeks ago, and actually it's less than half. The last few days have been less than half than what it was the first week of July. That is a positive trend. That doesn't mean that it's just gone, but that's a trend you want to see. When you see flattening of hospital census, that is a better trend. When this thing was running up, you were seeing the censuses escalate very quickly. So that's how these things go. But I would much rather be in a plateau than be in an escalation. And so I think the key is continue doing, the things. A lot of the people, they're just doing a good job throughout Florida. The elderly are taking special care, which I think is the most important thing, because since they're the most at risk. You have people that are physical distancing, wearing facial covers, hygiene, all the things that the guidelines that have been out for a while, have recommended. So I think that that's important, and I think that you will continue to see progress on it. Now, that said, you can have infections drop, you can have new hospital admissions drop, but you still have folks that are currently hospitalized. I mean, that's just the reality, and I think the outcomes are much better today than they were as a percentage in March and April, particularly compared to other parts of the country, but it's not something that's going to be 100%, unfortunately.
Governor, Congressman Cloud, with Spectrum News 13. Earlier this week, you talked a little bit about the need for more rapid results as it relates to COVID-19. Has the state looked into how the NBA is doing things? I know that their players get NBA, MLS, MLB, how they get their test results very quickly. A lot of people have been talking about that, and has the state looked into ways that we could get quicker results?
So here's the answer to the second question, yes, absolutely. I mean, we want to get as quick a results as possible. But I think the one point on that would be we're getting about 100,000 test results a day now. These sports leagues you're talking about, they'll do a couple hundred tests. So it's just a much difference in terms of the scale. If I only had 500 people in Florida testing, I could find a way to turn it around within 24 hours, no question. But we have so many people, so the question is how do you do that? So what we started doing was having lanes for people who were symptomatic. And I think what we may look to do is maybe convert some of, we have about 50 different test sites, walk up, retail, drive through, the whole 9 yards. I think what we may look to do is maybe take 5 or 10 of those and say, okay, this is priority testing. So the people that really need to get the results quick, I would say anyone 65 or older, anyone with symptoms, any healthcare worker, first responder, and then people who have had a kind of close contact exposure type of situation. And if you can do that, or even if you can just do most of that, we probably have relationships now where we can get the results back quicker. But it would need to probably be focused on that. What we're finding is, as this started to pick up steam again, a lot of people were concerned. They didn't necessarily have symptoms themselves, but they just wanted to know and they wanted to get tested. And that's fine, but if you don't have symptoms, particularly if you're in the younger demographics, that quick result is not as important as somebody who they need to get back in working in healthcare, or not as important as a senior citizen, just in terms of what the care would be or how that would affect the healthcare system. So I think we're going to continue to do these symptomatic lanes. We're going to look to maybe convert some sites into priority testing where we can try to get it back quicker. But I would just caution people, for those who have no symptoms, particularly some of the younger folks coming in, that's just not going to be as high a priority as the seniors and as the people that have the symptoms. So I think if you did it that way, I think we'd be able to harness the lab capacity in a better way. California's done something similar where they kind of have the priority of folks in terms of the testing. And I'd also just say, I think we got to have a better understanding or just arrive at some understanding based on what we've learned. I know some employers have said, well, you need to get a negative test before you come back. And I don't think that that's necessarily true for the general public. And the reason is you can test positive on a PCR test for up to 30 days. So these are people that are not carrying the virus anymore. So the CDC's put out symptom-based criteria for that. And so if somebody is out for a little bit, when they clear the symptoms by a certain number of days, they can then go back in. They don't necessarily need a negative PCR test. So we're learning more and more about this, but I think we got a pretty good idea of how long someone may be infectious. And so again, the testing is one tool, but it doesn't need to necessarily be used in all these different situations. And I think if we did that, I think that having these key areas, we'd be able to turn it around quicker. Yes, sir.
Dan Billow from...
No, go ahead.
Thank you. Dan Billow from WESH. Alexandria Ocasio-Cortez is speaking out about you, saying a comment in which she says that you referred to her as this girl, Ocasio-Cortez, or whatever she is, end of quote. That was dehumanizing in her description of it. Is there anything you want to say about that?
Wasn't that like 2 years ago? Yeah. Yeah, I don't know. I mean, that's that was, I think, a couple years ago, and so I'm not interested in dealing dealing with that. Yes, sir.
Dave Berman from Florida Today. Is there any point in the case numbers where you consider having mandatory mask policy or having more restrictions on retail stores?
So in terms of the business restrictions, we're not going to restrict the business. I think if you look at the spread, it's not really deriving from business as much as it's deriving from home outbreaks and then family and friends. And that's just the reality that we're seeing, I think, up and down the state. So I don't think that would be warranted. And I also think, all of our things, whether it's the senior citizens, sheltering, whether it's facial covering if you can't social distance, whether it's physical distance, whether it's hygiene, those are advisory. Those are not punitive. And we're going to continue to advise, but we're not going to impose any type of criminal penalties. It's just not. I don't think that would be effective. But I also do think that if you look, we clearly stabilized with the cases. The percent positive has been better the last week than it was the previous week. You know, we were at a point where we were 15, 16%. Now we're kind of, I think in that, actually we were below 11 yesterday, then today we were a little higher, but we're definitely trending in a better direction. And I think if you take out South Florida, the rest of the state is trending even better in that. Although I do think South Florida, is definitely stabilized, and I think Miami is showing some signs of improvement as well. So I actually think that that the trend. Look, you got to look at all. Then there's a whole bunch of different data points, but we're trending much better today, than we were 2 weeks ago. And I think that that's part of that is a lot of Floridians have done a lot of good stuff. And I think part of it is just, there are certain, this thing has a life cycle. It does have a certain trend that it tends to follow. And I think we're seeing that play out here as well. I think the physicians like it. I think that they've asked for more. I think that they believe that it's had positive outcomes. Of course, to really prove whether something works or not, you'd probably need to do a random controlled trial and compare people who were similarly situated and all that. So I don't know that we'll get those answers, but I think compared to where we were 3 or 4 months ago, this is something that is important to have, and if they believe that it's helping. And we've done whatever they've asked for, we did. We had some physicians are using hydroxychloroquine. We got a bunch of that delivered. We had the remdesivir delivered. The convalescent plasma, has been delivered. I think that the steroid is pretty widely available, right? You haven't had much of a problem on that. So these are just tools in the toolbox that people are using, and we want to be there. But ultimately, for me, I'm a facilitator. I'm here to support the doctors and support the healthcare professionals. I can't make a medical judgment either way, but if they tell me that they're using it and that the patients are responding well and that they could use more, that's all I need. I'm going to spring into action and help them. And so we've got even more coming, and we basically, I think, work with the White House so that, as it's being used, we're going to have a consistent supply coming into the state of Florida. So thanks, everybody.